Coming in prepared for the birth of your baby brings parents comfort and ease, knowing they have everything they need within their reach. You think you have to pack the whole house, but you really don't have to. A little piece of advice: do not overthink this process. For the first-time parents, I totally understand the feeling. I've been there too. So let's put all your worries aside, and if you forgot something, it's not the end of the world. Cheer up! Get your pen and paper ready and start listing the must-haves. In this video, I will tell you what are the essentials you need to pack for your labor and delivery in the hospital. I condense it to 5 must-bring and make it a priority to include them on your list. It is an exciting time for everyone, so try to make the packing as stress-free as possible. As a bonus, if you stay till the end, I will tell you the 2 important things you need to prepare before coming to the hospital. It's not something you need to put in your bag, so watch out for that. Welcome to Mother Baby Central, your resource for great information and education regarding pregnancy, postpartum, birth, newborn care, and baby's first year of life. The essentials I will tell you are the things that the hospital doesn't have and will not provide, so make sure you get them on your list and get them ready as soon as you can, especially if you're getting close to your expected date of delivery. Number 1, infant car seat with the base already installed in the car. I highly recommend that you purchase a new car seat for a couple of reasons. First reason, if you don't know yet, car seats have expiration dates. Yes, they do. So make sure if you are still keen on using a hand-me-down, double check those expiration dates. It is usually located on a sticker at the bottom or at the back of the car seat. Normally, a car seat expires 7 to 10 years from the manufacture date. Second reason, using an old car seat might have safety issues. The straps are probably worn out and the latch or buckle might be loose. And the car seat itself may not be as sturdy as when it was new. You don't want to risk putting the baby in there and not have those safety features in place. So please save money. Invest in buying a new one, or you can ask your friends and family to get one for you, or you can put it in your baby registry as well. Most of the car seats usually start for weight 5 pounds and up. Number 2, baby outfits and going home blanket. The hospital will provide a white long sleeve baby shirt and swaddle blankets, and usually they would not let you take them home with you. So be prepared and pack those right now. Also, if you want to make sure the baby wears appropriate clothing, bring a few onesies, some short and long sleeves, some jumpers or gowns, some mittens, some burp cloths, and some socks. I said appropriate because the hospital does not have baby long pants or pajamas. You want to make sure you keep your baby warm, especially for the first couple of days. I am also certain you want to take lots of baby pictures that you want to share with your friends and family. So bring those cute little outfits and the baby will be camera ready anytime. Number 3, mom's outfit, nursing bra or regular bra, and a high-waist underwear. While we are on the topic of outfit, moms, please bring with you your going home outfit as well. The clothes you wore when you arrive at the hospital could be your going home outfit, unless something happened that made it unusable, like you broke your water on the way to the hospital. Well, assuming that none of this happened, then you can save that outfit for later when you're ready to go home for discharge. Also, pack some pajamas and shirts or comfortable sleeping gowns or nursing gowns as you wish. For breastfeeding moms, pack those nursing bras, and bottle feeding moms, bring your regular bras. Pro tip for bottle feeding moms, wear your bra immediately after giving birth to provide support and make them snug to avoid stimulation, which may result in the production of breast milk. I mentioned high-waist underwears because they are very comfortable for moms who had C-sections. It prevents the waistband from rubbing on the incision. The hospital will provide disposable underwear, but if you don't want to wear them on the way home, hack your own. If you're loving this content so far, please click on that subscribe button and be a part of our community. It gives me so much joy talking about these topics, and I want to share with you my knowledge and experience I gained from working with moms and babies through the years. Let's get on to number 4, rubber slippers. Why? You don't want to be barefoot while you shower, right? I don't want to. Not on the hospital floor. I think there is no more explanation needed on this matter. You might also want to do some walking laps in the hallway. By the way, highly encouraged. Get that blood circulation going and prevent blood clots from forming, which women who just delivered are at a high risk for. The hospital provides socks with rubber grips at the bottom to prevent patients from sliding and falling. But your feet might feel too hot for those. Remember, hormones, it can make you feel hot and sweaty all the time. Also, some moms will have swollen feet after delivery, and you might not be able to fit on those shoes you pack with you. So, as a backup, if everything else fails, if the shoe doesn't fit, rubber slippers to the rescue. And going to number 5, gadgets like phones, tablets, chargers. Most people don't forget to bring theirs to the hospital. But sometimes things suddenly change and you need to proceed to the hospital immediately. Include this on your list. If you have a longer cord for your chargers, bring those because the wall outlets could be far from where your bed is or where your partner's sleeper chair is. You might need to charge that phone while feeding the baby. Therefore, it is good to have them at your disposal. Now you ask, how about baby diapers and wipes? How about formula for bottle feeding, pacifiers and breast pumps? Don't worry, all this will be provided by the hospital. They got you. How about pads, peri-bottle, underwear, socks, or foodies? They will provide these as well. Some supplies like Tux pads, Epifoam, Dermoplast spray for vaginal deliveries, hospital will provide that, and also an abdominal binder if you have a C-section. Since all of you are special, I also prepared a secondary list of stuff you might want to consider bringing to the hospital. But let me remind you, this list can be endless. It really depends on what kind of person you are and what are the things you cannot live without. I am sure you can survive a couple of days without them, but if you insist, here they are. Number 1, makeup kit, including a lip balm. I especially mention lip balm because it's just one of those things that can make you feel comfortable after a long labor. Some moms are used to wearing makeup, and for those who don't, consider packing them as well. Maybe just a simple lipstick and some blush on. It can add some life to your face after that 24 hours after giving birth. Number 2, your kind of brand for toiletries, like your favorite shampoo, hair conditioner, face wash, moisturizers, and so on. Number 3, pillows for you and your husband, your boyfriend, or your partner. The hospital will provide pillows, but most of the time they will only provide 1 or 2. If you want to make sure you will have a comfortable sleep, bring your own. It is also helpful to have a few extra pillows for breastfeeding to properly position the baby and for you to have adequate back support if needed. Number 4, favorite snacks and drinks. The mother-baby unit has a limited choice of snacks they can offer. If you are okay with graham crackers, some salted crackers, and apple juice, then you should be fine. But if you want something better, pack those favorites with you, and they will be especially helpful for those nighttime feedings. And number 5, hair dryer. Some hospitals don't have it. You can call ahead and check if they have one in each room. If you are planning on having professional pictures done in the hospital, you probably would want to consider packing some flat or curling iron just to get your hair nice and ready for those pictures. And now for the bonus tips. 2 things you need to have prepared before giving birth. Number 1, pediatrician's name and contact information. Make sure you already spoke to the pediatrician or you did some interviews while you are still pregnant. And pick your baby's doctor prior to delivery. You can actually make an appointment to talk to them and get to know them to see if they are the right fit to be your baby's doctor. The hospital will need the pediatrician's information after you give birth, so make sure you have it ready. Some pediatricians have hospital privileges, and if they do, they will be able to see your baby while you and baby are still in the hospital. Number 2, baby's name. I really hope you have the name ready before giving birth. Remember, this is one of the things you need to ponder on and research for a long time. Do not make hasty decisions and pick one just because you have not prepared anything. Now, I do understand in some cultures, they don't pick a name until the baby is born. This is perfectly fine, but remember, you only have a couple or 3 days to choose a name. If that's the case, you have to fill out that birth certificate before going home, so prepare a few to pick from and choose the best one when it is time. I hope you find some great value in our video today. Please share it with your friends and family if the content fits them as well. So, if you would like to know about the typical appearance of the baby immediately after birth, check out the link of the description below. Happy watching!